Thank you, Chris, and thank you for being part of this cosmopolitan panel. I'm not a German in London. I'm not an Englishman in New York. I'm a Norwegian here in Rio. And the first plenary session reminded us about our common future. The former Norwegian Prime Minister and later Director General of the World Health Organization led the Commission launched here in Rio on sustainable development. And my first message to you is that primary care is sustainable. Primary care is delivering effective care. Here's a comparison between countries with a high primary care level and countries with lower primary care levels. They achieve lower mortality. They also are more efficient, cost value for money. And these are data from the late Barbara Starfield, a giant and pioneer in the field of understanding the impact of primary care on the health system. She sadly died just a couple of weeks ago, far too early. Then, primary care is integrated care. It's not about single episodes. It's not about single technologies. It's about meeting patients in an integrated fashion. It's about chronic care management, and I've used the model here of Ed Wagner, the chronic care model. I won't go into detail, but just focusing on a couple of domains. They emphasize the need for self-management, how we can actually put users and patients in charge of their own health. They emphasize the need for delivery reforms and delivery changes where they are based on the best available evidence, because that delivers best outcomes. And they focus on the need for decision support. And the good kind of history also of this model is that it was kind of components was based on research. They went through a lot of research literature of what are the kind of key components that would deliver chronic care in a best way. Then they focus, so that's one way. The other way is that they focus as a part of that model on evidence-based care. And thirdly, the model as itself has been evaluated rigorously and shown that it actually achieves what it wants. And finally, primary health care reforms. What do the World Health Organization tell us about how to improve primary care? The two recent World Health reports, one from 2008 and one from 2010, both are relevant. And they speak about the need for universal health coverage, so financing reforms. They speak about the need for delivery reforms, focusing more on patient-centered care and community care. They speak for the need of leadership reforms and reforms in other sectors that also affect health, so public health. So why this introduction? My kind of concept when it comes to technology is then wider than the previous speakers probably. I looked up in Webster, and technology is there defined as the practical application of knowledge. I think this speaks to us that we need to think differently of how HTAI can actually support efficient and effective primary care. It speaks to our processes. We need better user and community involvement. We need to involve primary care physicians, GPs. Our methods, approaches, should focus more on implementation and integration of the technology in the health sector, not only about decision-making, yes or no. We need to link our efforts in the HTAI community to other efforts to improve the quality of care. And we should assess kind of full clinical pathways, not just kind of individual interventions. We should really understand that they are a part of a larger system. It also addresses the need for maybe rethinking what kind of topics we are addressing. We should focus more on public health, more on service delivery and organizational care, and more on health systems issue, because those are the main issues of primary care. So I think our community needs to join forces with health services and systems research if we want to achieve better implementation and higher quality of primary care. Thank you.